Category of mineral, potassium. Potassium is divided into two categories, which is intercellular and extracellular. Intercellular is maintain osmotic pressure, which is potassium, unlike sodium, has relatively little influence on osmotic pressure. The sodium potassium pumps in the cell membranes, which maintain appropriate potassium concentration gradient between intercellular and extracellular fluid, are to blend for the low potassium level in the blood and cerebrospinal fluid.
Assalamualaikum and hi, my name is Siti Sarah binti Bazli. My number metric 2020245336. So today I want to share about definition of potassium. Potassium is a chemical element in the family of alkali metals with the chemical symbol K and atomic number 19 because it has 19 protons in its nucleus. Potassium metal has a silvery luster, is soft and is easily cut. Potassium was discovered in 1807 by Sir Humphrey Davy, who derived from caustic potash. It was the first metal isolated by electrolysis.
Assalamualaikum and hi everyone. My name is Miftahujana binti Swandi and my student ID is 20208176 and 54. And for the next slide, I will present about the benefits and function of potassium. Potassium is classified as a micromineral and is the major intracellular cation required for normal cellular functions in the body. And potassium plays an important role in our body and is a critical various vital functions. And this is the benefits and function of potassium. So firstly, potassium helps to lower blood pressure, and enough potassium intake may prevent high blood pressure. It is recommended that high potassium and low sodium intake can prevent cardiovascular disease. The second function of potassium is as electrolytes. So, potassium is classified as an electrolyte in our body, and when it is dissolved in water, it will produce charged ions. Hence, this property allows it to conduct electricity, which is important for many processes in the body. Potassium also helps in nerve impulse and muscle contraction. Potassium is vital to transmitting nerve signals that lead to skeletal muscle contraction, smooth muscle, and heart contraction. Potassium also helps in digestion. So, potassium helps in taking signals from the brain and sends them to the muscle of the digestive system. After receiving the signals, digestive muscles start contraction, and the digestive system churns food so it can be digested. And next, potassium also helps in maintaining heart rhythms and also pH balance. So, potassium and hydrogen ions interaction help in transport both the cellular and renal levels, which is crucial for the maintenance of acidity. And last but not least, the benefits and function of potassium is work as bone mineral density in our body. Optimum potassium intake is considerably associated with an increase in bone mineral density and provides strength.
Assalamualaikum. My name is Alia Atira binti Azhar. My student ID is 2020496672. So, I will continue about the sources of the potassium. Potassium can be found naturally in foods such as fruits and vegetables. So, eating diets high in potassium has been linked to reducing blood pressure, decreasing the risk of stroke, improving bone health, and reducing the risk of nephrolithiasis, or known as kidney stone. Therefore, consumption of foods that is rich with potassium provides many benefits. There are several food groups have been recommended. Firstly, from legumes and legume products, it have soya bean 397 milligrams, chickpea 345 milligrams, kidney bean, tempeh, and fermented soya bean paste. Secondly, from fish, only tuna that is 344 milligrams. Next, from nuts, it have cashew nut 410 milligrams and dried walnut. Besides, from vegetables, it have spinach 385 milligrams, cabbage 103 milligrams, carrot 136 milligrams, potato, sweet potato, small onion, pumpkin, tomato, and cucumber. Moreover, from milk product, it has only yogurt that is 153 milligrams. Lastly, from fruits and fruits products, it have banana 379 milligrams, dates, papaya, and tomato juice.
Hello and Assalamualaikum everyone. My name is Najiharhi binti Ikmal Azmi and my matrix number is 2020460032. I will continue present about deficiency of the potassium. As you can see on this slide, deficiency of the potassium is a situation when serum potassium concentration is less than 3.5 millimoles per liter, and this is called as hypokalemia. This is because the body excretes too much potassium. Hypokalemia, which is low potassium that occur glucose intolerance by altering the pancreas activity by reducing insulin production. Other than that, it can cause high loss from the gastrointestinal tract and kidneys, such as during prolonged diarrhea or vomiting that can lead to potassium deficiency. For your information, hypokalemia can be prevented by eating food rich in potassium, such as banana, avocado, potato, raisin, spinach, and others. In addition, heat exposure and high levels of activity can lead to an increased potassium loss, typically through the excessive sweating. Now, we talk about side effect of hypokalemia. First is cardiac arrhythmias that cause your heart to beat too fast or too slow. Second, muscle weakness, which is lead you to feel like you don't have as much strength as you used to. Third, glucose intolerance. Next, fatigue, a general context of tiredness or lack of energy. And the last one is paralysis, which is the loss of muscle function in a part of the body because something is wrong with the way messages are sent between your brain and your muscles. Now, I will present about toxicity of the potassium. Toxicity is a situation when serum potassium concentration above 5.5 millimoles per liter, and this is called as hyperkalemia. This is because too much potassium in the blood, and it causes kidneys are unable to filter out excess potassium. For your information, hyperkalemia, which is high potassium, can be avoided by limiting or removing certain high potassium foods, such as orange or orange juice, sweet chard, banana, avocado, potato, raisin, spinach, and others. Next, hyperkalemia can be managed or treated by doing treatments such as diuretic and dialysis. Diuretic is a treatment, sometimes known as water pills, cause you to pee more frequently. Potassium is mostly excreted in the urine. If potassium levels remain high or you experience kidney failure, you may need dialysis. This treatment helps your kidneys remove excess potassium from the blood. Now we talk about side effect of hyperkalemia. First, cardiac arrhythmias, shortness of breath, muscle weakness, chest pain, nausea, vomiting or diarrhea. Both low blood potassium levels, hypokalemia, and high blood potassium levels, hyperkalemia, can lead to abnormal heart rhythm.
Hi, Assalamualaikum. My name is Patricia Dania binti Ibrahim. My metric number is 2020497694. So, today I want to talk about recommended nutrient intake in Malaysia of mineral. Adequate intake level for potassium in this diet are based on neutral potassium intake from dietary source, especially fruits and vegetables. The available evidence suggests that this level of potassium intake should lower blood pressure, blunt the adverse effect of sodium chloride on blood pressure, reduce the risk of gallstones, and possibly reduce bone loss. Therefore, the Technical Subcommittee SC on Mineral and Trace Element proposed to adjust the recommendation from IOM 2006 for RNI value for potassium, as it has recommended a set of dietary reference intake value for different age group as well as pregnant and lactating women. The comparison of recommended intakes for potassium from RNI Malaysia 2017, AI IOM 2006, and RNI WHO 2012 as is follow. For infant, the estimated value for potassium intake are set at 0.4 gram for breastfed infant age 0 to 6 months. The intake is estimated based on the average volume of milk intake, 0.78 liter per day, and for infant age 6 to 12 months, it can be determined by estimating the intake from human milk, 0.3 gram per day, and complementary food 0.44 gram per day. So for the potassium intake will be around 0.7 gram. For children and adolescents aged 1 to 18 years are obtained by extrapolating from adult RNI is based on the average median energy intake level. This is due to concern that the adjustment is based on low weight and potentially to indicate potassium intake. RNI for children and adolescent age 1 to 3 years is 3.0 gram, 4 to 8 years is 3.8 gram, 9 to 13 years is 4.5 gram, and the last one is 14 to 18 years is 4.7 gram. The RNI for adult from age 19 to 50 years is set at 4.7 gram, which can give beneficial effects such as reducing the risk of gallstone, lowering blood pressure, and reduce bone loss. For older adult, the RNI is set at the same intake level as for young people adult, which is 4.7 gram, but this RNI does not apply to individuals who have health problem or are taking drug which affect the excretion of potassium. For pregnancy, potassium accretion during pregnancy is very small and there is an absence of data to suggest that the requirement for potassium is different during pregnancy. Thus, it is set at 4.7 gram, the same as non-pregnant women. The last one is lactation. The potassium content of human milk average around 0.5 gram per liter during the first 6 months of lactation. Average milk production during the first 6 months of lactation is about 7.8 liter per day. Thus, the RNI for lactation from age 14 to 15 years are the same, which is 5.1 gram.